I'm Nicole McSweeney, Chief Marketing and Philanthropy Officer here at MaineGeneral, and I'm joined today with our Chief Medical Officer, Dr. Stephen Diaz, to talk about some recurrent questions that we're getting about the safety of the COVID-19 vaccines.
Hello, Nicole.
Hi there. Thank you for joining us today. It'd be great if you could talk to us today about how quickly the vaccines were developed and how big the trials were and whether or not any steps were skipped in the approval process.
These are great questions. So vaccines have been around since 1796, and the technology between then and now is quite different. So the vaccines came to market in December 2020, and of course they only had about a year to be developed for the COVID pandemic. Yet the mRNA technology, for which both Pfizer and Moderna vaccines are based, has been around since 2008. The University of Pennsylvania developed the mRNA technology to modify the messenger RNA, and when they were done, they said, hey, this technology would work great for either gene therapy or vaccinations. So you fast forward a few hundred years, we've had technology available to us for such a problem such as the COVID pandemic presented, and we took advantage of it. So Pfizer and Moderna spun up their smart people to then move on this, and unlike a few hundred years ago, yes, they were able to bring it to market much sooner. Both vaccines have been approved by the Federal Drug Administration, the FDA, under something called emergency use authorization. What they say is that you have to have a study showing the safety and efficacy in a realm for which we can find statistically that this makes a difference. So they both had somewhere between 35,000 to 44,000 people participating in their trials, which is a big number. And those numbers found, and those trials found with those numbers, that they were both safe and efficacious. And Johnson & Johnson to the same effect. You know, Johnson & Johnson is a different type of vaccine. It's a vector from an adenovirus, which again is not new technology, just new in this application. Actually, Johnson & Johnson have been looking at using that for Ebola vaccines as well, previous to the COVID pandemic. So all three vaccines have been studied. They all have that authorization from the FDA, and they've been well studied now in the sense that in the United States we've given over 130 million vaccinations, and the safety then is based upon those reporting coming from those vaccines being used. So we're very comfortable that these are making a difference, they're safe and they're efficacious, and yes, they came to market rather quickly.
So one of the other questions that we're getting, you speak of Pfizer, Moderna, and Johnson & Johnson, and there's some question of, should I or any of us get one vaccine over the other?
Yeah, so at this point, no, they're all equally efficacious, and the real outcome that you want to look at is what happens clinically after you get vaccinated. So you'll hear people talk about efficacy and efficiency and uptake, and those are great, but the real question is, will being vaccinated by any one of these reduce my chance of dying, hospitalization, or severity of disease? And the answer is all three check the boxes of yes. All three decrease the chance that you'll die, have severe illness, or need to be hospitalized. So it's a win to take any of the vaccinations.
That's great. Now, thinking about kind of the short and long-term effects of the vaccine, you know, some people are wondering, you know, what they might get for a side effect or what illnesses they may get if they choose to get the vaccine.
Yep. The very first thing to remember is we give vaccines to stimulate your immune response. And so it's very common after a vaccine to have a headache, fevers, muscle aches, sore throat. Those are all common side effects, rashes. The real question is, well, overall, you know, I see reports where these vaccines can cause horrible things that happen 1 in a million. The hard part about that discussion scientifically is those 1 in a million things happen to people rarely, but they occur idiosyncratically. We don't know when they occur. So sometimes when we have something done to us, we say, oh, I had this happen to me and I had a vaccine 2 weeks ago. But linking that together scientifically is very difficult because these are rare diseases anyway. So by and large, we don't see, I guess the best way to answer is, we don't see an uptick in rare diseases occurring on those who get vaccinated or not. But we do see the more common fever, headache, muscle aches after these vaccines like we do with any other vaccine. So in some ways your immune system's working, And you may get no side effects from the vaccine. It doesn't mean they're not working. It all has to do with the fact that everyone's immune system is different. So the common vaccine side effects are the same here as with other vaccinations.
Great, great. So the other interesting question we're getting is, does the vaccine alter our DNA?
It does not. So the 3 vaccines in the market, 2 of them, the Pfizer and Moderna, use messenger RNA technology, and then the Johnson & Johnson uses something called the vector adenovirus technology, which uses another virus. And viruses, as you know, are either RNA or DNA pieces. The RNA and DNA do cause things to happen for which we create an immune response to help protect us. But those segments do not get incorporated into our DNA. They do not alter our DNA. They don't become part of our DNA. They're just pieces used to help the cell machinery create what we need to in order to create an immune response. So it's a great question. It's something that comes up all the time, but no, it is not incorporated into our DNA.
Okay. I think this might be the next $1 million question,
Oh, great.
which really is, how long will the vaccine last? How will it wear off over time? And will we all need booster shots of the vaccine?
So this is truly a time when we are building the plane as we are flying it. The pandemic is now a year old. The vaccines have been here for 4 months. We are starting to get some experience with them. Yet a lot of the long-term studies, of course, could not be completed because we haven't had long-term opportunity. So we don't know exactly how long the vaccine lasts, but the best minds think a year or more. The other question is, how does this play into the variants? Variants occur with all vaccines all the time. Some variants are beneficial to us. That is, the change makes the virus less virulent, less spreadable, transmissible. And so that's good. That's good for us. And some variants have an advantage, and that is they are more transmissible, cause more severe illness, or just cause more illness because they're more infectious. So the variants you're hearing about, of course, the ones that are advantageous to the virus. The best way to quell the variant evolution is to become vaccinated, is for the community as a whole to become vaccinated. So until we answer how the variants do with different vaccines, the first question is, can we get to herd immunity, or 60 to 80% of the world population vaccinated so the virus stops spreading so rapidly? That'll tempt down the variants. Then you will want to figure out from those who have been vaccinated what variants are able to still transmit, and there'll be some that do and some that do not. That's still being sorted out. And either way, once we know how long the vaccines last, we may need a booster. We may need a booster with the original vaccine because we find that it wanes and it's still the most prevalent one, so we should be vaccinated. Or, as Moderna is doing, you may want to alter your vaccine so it covers more of the variants, in which case a booster would be very helpful so that the variants are also suppressed. So a lot of this, though, is being developed and studied as we exist.
So more information to come on that as we know it.
Yes, I always tell people I'll be smarter in a year.
I like that. All right. Another question we get quite frequently is the impacts on fertility and pregnancy. And is this really safe?
Those are another great questions, and we'll take them one at a time. The fertility question has been studied in the populations under the emergency use authorization, and there is no effect on fertility from the vaccinations.
Right.
As the previous answer with boosters and variants, we are still learning about pregnancy. So the American College of Obstetricians and Gynecologists has suggested that pregnant women talk to their PCPs or gynecologists, obstetricians, to figure out what's right for them. But by and large, they are not against giving the vaccine. And partly, the reason they answer the way they do is that pregnancy itself is a risk factor for more severe disease.
Sure.
So again, all these are risk-benefit discussions, but right now we don't have any evidence that being pregnant and receiving vaccines is a detriment to the mother or the fetus. And we don't, of course, we're still studying and getting information to see what the long-term outcomes of all these things mean. But we do know, as I just said, that if you are pregnant and you get COVID, your chance of more severe disease is higher than the general population.
So thinking about any person right now that has questions about any of their own chronic disease or how this vaccine could impact them personally, who should people reach out to get some of their questions answered?
Yep, you should reach out to the healthcare professional who knows you best, so your PCP. This is the same as with any other discussion of something you do for your health. So whether you might think you need the shingles vaccine or the pneumococcal vaccine, or whether you should be on medications for your blood pressure, everything is a risk-benefit discussion. So if you have questions about whether or not the COVID vaccine would be beneficial for you and you have concerns because of your comorbid diseases or other things going on with you, please talk to your PCP. But by and large, getting vaccinated is a benefit to both you, your family, and the community, which is why we are advocating that people get vaccinated.
That's great. Thank you. So thank you for joining me today to help answer some of these commonly asked questions of our patients in our community. And I would say to stay up to date on how Maine General is adapting to COVID, we keep our most up-to-date information on our website at www.mainegeneral.org/COVID.
Thank you very much.
Thank you.